Hi everyone, it's Dr. Jada, the pelvic floor physical therapist at our East Norristown location. If you've watched my videos, which I hope you have, and if you haven't, go watch them, then you know pelvic floor physical therapy is a lot different from other forms of physical therapy. So today I will be talking about what happens during the initial exam for pelvic floor PT. Now, since the things that we talk about here in pelvic floor physical therapy is more intimate and personal and private, as well as so is the exam portion, you are going to be inside of a private room. You will not be inside of the gym during our initial evaluation. Okay, the private room is nice and secluded and spacious with a table, as you can see. And we will start with a subjective portion, which will be me asking you questions about what brings you in, any concerns you have, your symptoms, your pain, things like that. And I will give you a chance to share everything you need to share, or everything that you want to share as well. And then after that, I will ask you birth history. If you have symptoms that include sexual dysfunction, I will ask you questions about that. I'll ask you questions about toileting frequency, such as how often do you pee, how often do you poop, and as well as details about those things as well. Now, since the things that we talk about is more on the private side, if there comes up things about trauma or an injury that you don't feel comfortable sharing, that is okay. If there's a question that I ask you and you would like to skip it, that is okay as well. I want you to be comfortable here, especially with these type of topics. So if you don't want to share it on the first visit, that's fine. If you don't feel comfortable sharing until the 8th visit, that's okay too. I just want to make sure that I have enough information to help you as best as I can. The next portion will be an internal exam if you are okay with it. Now, the internal exam, if you have a vagina, it will be one finger, gloved and lubricated, and within that internal exam, I will inspect the integrity of your muscles, the strength of them, coordination, as well as endurance. And during that, I will cue you through it the entire time. I'm not expecting you to just know how to do all of the things that I ask you to do. I will also take a look at your vulva and inspect the skin, the integrity, if you have any scar tissue, see how it moves around and things like that. Now again, since this is very private, if there's any time during the examination that you want me to stop, that is okay. I want you to be very vocal and let me know, and we'll stop. And that'll be the end of it. It's totally fine, all right? So this exam is different from going to the OBGYN because there are no stirrups, there is no speculum. It is just my finger. And if you are coming in and you have a penis, then things will be a little bit different. So I will inspect the tissue of the perineum. So I may ask you to lift the testes and the penis up so that I can see the tissue around it. And then most likely I will have you turn onto your side, and then I will do an internal exam into the rectum. Again, this will be done with a gloved and very lubricated finger. And if it's something during the exam that you're uncomfortable with, or if you feel pain, I want you to, again, be very vocal and let me know so that we can stop. And that is okay. So during my training, in order to pass the courses, I had to have the internal exams done on myself. So it was internal, vaginal, as well as rectal. So I do know what it's like to have this internal exam done. So I'm okay with you being vocal and letting me know that you are uncomfortable and that you want me to stop, and I will stop immediately. And then once those internal exams are finished, of course, I will give you your privacy to dress, and then I will enter the room again. I usually tell people, use the baby wipes to clean up, and then once you're ready for me to enter the room, you can just crack the door just a tiny bit and I'll enter. And then if we have time, then I do like to assess hip strength and some functional mobility, as well as see how your spine is moving around. But because the internal exam is so important, I do not rush that portion of the process. And so if we don't have time to do everything else, that's okay too. We'll just get to it next time. And then to conclude the evaluation, we will go over the findings of the internal exam as well as a plan to efficiently and effectively treat your impairments. And then I always leave time for questions. And you can ask as many questions as you need to. There is no rush. This process typically takes 1 hour. And at the end of the exam and the entire evaluation, we will, go over everything. And then I will walk you out of the room and then get you scheduled for your follow-up appointment. If you have any questions, feel free to call me at our office. The office number will be listed below, and I will answer any questions that you have. I hope this helps. Bye.